Hi, I'm Dr. Sood, and I'm a radiologist at SCP, and I'm a cardiothoracic and general radiologist by training.
My name is Thuli Mtwana. I am a diagnostic radiographer.
So an X-ray is probably the easiest, most accessible investigation of choice to have a look at the internal structure of the knee. Mostly we're seeing the bones and soft tissues, but from that we can infer a lot of things about the injury. So we can see fractures, we could see evidence of prior dislocation or tumors, things like that, which may contribute to the patient's pain. So generally, you can confirm a diagnosis, and that will help a clinician decide whether further imaging is needed, or alternatively it can be used in follow-up to see whether, for example, a fracture is healing over time satisfactorily.
The first point of contact for any patients that come to the department will be our reception area, where they get their file opened, and then everything gets sent through automatically at the back with the radiographers. We read the referral letter and see what examination is required from us to perform and what views then we will perform on the patient, depending on what the history of the patient is. So if the patient has had a knee injury, I would find the patient in reception. If they can walk with me, or I will assist them in whatever way I can, whether it's on a wheelchair or a casualty bed. Usually, with patients that come for knee x-rays, if they are fully dressed with long pants or anything that covers the knees, would get them changed into our hospital gown, because we want that area to be exposed, and then take them into the x-ray room where we will perform the examination. We then make the patient comfortable on the x-ray bed, and we're going to perform firstly an AP view of the knee, which is a frontal view, and then we'll do an x-ray that is 90 degrees to that, which is what we call a lateral view. It's a side imaging of the knee. Then we can also give the radiologist an oblique view, just to see the injury at a different angle. So those are the three standard views that we'll do for a knee injury patient. If the patient is unable to move their knee, there are alternative ways to achieve the same type of x-ray that we can do. For example, instead of turning the patient onto the side to get a lateral imaging of the knee, we'd do what we call a shoot-through, where they remain in the same position, and then we just move our machine to acquire the same view of the x-ray. After positioning the patient, I then step behind a screen where our computers are, and this happens every time after positioning the patient. So for each view that you do, you step away and go behind the shield where you press the button and take an image. Everything gets sent to the referring doctor, and then the referring doctor will then communicate with them what the results are.